Assalamu alaikum everyone, this is Shibra from Gateway Study Links, and today we are taking or conducting, you can say, a mock of OET as we conduct of IELTS. So I am going to be the observer here, and with me Dr. Karamat is here, and who is playing a role as a student or a candidate, and with me I have Sir Mubarik, who will be the examiner. And over to you, sir.
Okay.
Right.
Fine. So thank you very much, Ms. Shibra. Now, behind the scene, I have given 3 minutes to Mr. Doctor already, and let's see that how much is he prepared. As far as the linguistic criteria is concerned, Ms. Shibra would be giving her feedback, and on the other parameters, I'll try to judge the doctor. So we are trying to make an intensive care unit in the house where I could see how doctor performs in ICU. So, shall we start?
Sure.
Are we good to go?
Sure.
Okay, so before we start, I would like to know about yourself, what you do, and where you work.
Actually, I work in CD Hospital as a casualty medical officer.
Okay.
Further, what you want to ask related to me?
I need to know about you a little more, what you had been doing in the past.
Okay. Actually, I'm a medical student.
Mm-hmm.
I did my graduation. I'm a foreign graduate.
Okay.
Later on, I have completed my house from Lahore General Hospital.
Mm-hmm.
And basically, I belong to Kasur, District Kasur.
Fine. Actually, the one I asked already, these are not part of our assessment, so I just wanted you to get familiar with us. And now I would like to start my role play situation with you. So, over to you, please. You start and then I'll be with you.
Hi, how I can help you?
Good morning. Can I meet some doctor here?
Yeah, I'm a registered physician in this hospital. How I can help you?
A doctor, actually, my partner, my spouse, she has pointed out one of the lesions I have at the back, rather the lower back to be exact with you, at my back. So I am concerned about it. I would just like to get myself examined for that.
Okay, let me first, I want to know some personal information.
No
What is
problem.
your name, please?
I am Alex.
And what is the name of your spouse?
Her name is Liana.
Liana. Okay. When did she first time notice this specifically and you are mentioning about?
I'm not pretty sure about it, but today in the morning, right, she forced me to come to you. In the morning, she highlighted that there is some scar, maybe some mark. I'm not sure about it, the kind of thing I have at the back. So she just highlighted that today.
Okay. Some further information I want to ask related to this specific ulcer or mole you are mentioning about.
Yeah.
Can I ask some further questions related to her age as well as her work schedule, daily routine work schedule?
I'm not sure about it, sir. You want details of her or of me?
Or related to her patient?
Okay. She is basically 34 years old. Okay.
Okay.
And I believe you need to counter check it again.
Okay. If you don't mind, I want to examine that specific mole.
Okay.
So, if you
Would,
will allow.
would a picture be okay?
Picture will okay, but I want to examine by myself
Okay, fine.
because
Okay.
it
You
will.
go on, please. Check that out.
Okay. Okay. Thank you.
Mm-hmm.
According to my assessment after my examination,
Mm-hmm.
it's a benign mole,
Okay.
or it can be a birthmark.
Mm-hmm.
So, I think it was previously located at this place, and might she notice
Mm-hmm.
few days ago.
Okay.
But it's look like a birthmark, and
Mm-hmm.
there are several procedures to manage such mole or birthmarks.
Doctor, let me talk about my history. My father actually died because of that lethal cancer, skin cancer, you may call a malignant cancer. So I'm quite concerned about it. I'm not quite convinced with the talk. Based upon just your 30-second assessment, I think you need to dig down into it.
That's what I'm saying. First of all, it's terrible to know about your father. It's so sad.
Mm-hmm.
So that's what I'm saying. There are several procedures. First of all, I will take a sample, so-called biopsy,
Okay.
and I will send it to lab, and histological report will will show further path, how we can proceed, how we can manage it. So
what will I do about this now?
at this time, I will advise a biopsy. So I biopsy, I will take a small piece, or I will excise a small piece.
Would that be hurting?
No, this procedure will I will proceed under local anesthesia. It's mean it will not hurt as much.
So don't you think that I should go to the hospital straight away and have it removed completely?
No, in hospital you have to follow that same criteria. That's I'm talking about. They will take a sample or a biopsy, and later on, after 1 or 2 weeks, you will get a report from lab, and that specific report will show us how we can proceed further related to that specific mode.
So what if my fear comes true and I am kind of, maybe I'm cancerous or someone? So what would happen then?
Let me reassure you, according to my assessment, as what I have examined that specific lesion, it's most likely a benign. But we have to rule out because such situations can be malignant. So,
don't you think, will I get sick like my father, maybe die in the end?
no. Just may reassure you again, it's most likely a benign lesion. Yes, you have family history.
Okay.
It can be a suspicious, but at this time I can reassure you, most likely it will be a benign. So lab report further will reconfirm whatever I'm saying.
So will I need some operations or maybe some chemotherapy or something?
If it will be a malignant lesion, then there are several approaches.
Okay.
For example, you might have to go through chemotherapy, radiotherapy, or its complete excision will be fine.
Okay.
So might be there excision as well as chemotherapy or radiotherapy.
All right. Okay.
Anything else you want to ask?
For now, I believe I am kind of half convinced. Okay, I can go by your procedure, and then we'll look into the reports, and then we can decide better, I believe. But I am quite concerned about it, sir.
Okay. First of all, I will tell you, you are in safe hands, and I will proceed in your best interest. So let me sum up whatever we have discussed up till now. You are concerning about a mole.
Okay.
So that your spouse got. So according to me, it's a benign lesion, and for just your confirmation, I will take a biopsy sample, and I will send it to lab, and according to that specific lab report, I will proceed further. So thank you so much. If there is any question, I will be available for you.
Thank you very much for your time, doctor. I'll see you around.
Thank you.
Thank you. Okay. Okay, how was it?
अच्छा था.
Really? You couldn't get the patient, first of all, you know that?
जी.
The spouse was not the patient. I was patient myself. Look at the first line. You are 34 years old. Your spouse recently noticed a small dark skin lesion on the lower part of your back. Spouse? You said what is spouse? So I said spouse is wife. You didn't ask me that who is patient here.
No, I was thinking that she got more, not you.
It's mentioned, you know. Okay. You are 34 years old. Your spouse recently noticed a small dark skin lesion on the lower part of your back. Okay. So she noticed on my back. Of course, I cannot see my back. Okay. Thanks to the cameras now. Okay. Besides that, it's always so good to ask from the interlocutor you have. You can. There is no harm in that. Okay? वो behind the scene जो हम बात कर रहे थे. It is there permissible. So you can ask the things. Your starting and ending, I have my doubts about it. Over to the expert, ma'am.
Right. Okay.
You may speak in that, please. Okay. Thank you.
Right. So basically, the thing is, I have noticed some important, you can say, points. So basically, you covered all the points. For example, like Sir Mubarak was asking you the questions and you were giving like complete answers. But the thing is, again, the very important thing that you forgot that who is the patient, right?
Exactly.
So yeah, that is the thing. Other than that, the pronunciation. Yes, there are like some, you can say, words that you pronounce like incorrect. For example, it's biopsy, and you were saying like biopsy, like. You were kind of like, differently you were saying that, you were saying like biopsy, so basically it's biopsy. And the next one is, the next word is chemotherapy. It's therapy, and you were saying chemotherapy. So yes, there were like two words. I noticed that you were kind of like pronouncing very incorrect. Other than that, the sentence structures was kind of like good. But at the end, you tried to finish the conversation off. Like you suddenly said, "Okay, thank you so much." You first, and after that, you said that any more questions you can you have then. So basically, you were trying to kind of like finish this conversation off. So you have to ask the patient questions, that is everything okay now, or do you have like more questions? And at the end, you have to say thank you. First, you said thank you, and then you were kind of like said to Sir Mubarak that you have any questions or that. Right.
That's it.
Yeah. Thank you so much from my side.
Thank you.
Thank you.
All right. To cut a long story short, overall, I'm okay with this. Identifying the patient is, of course, part of it, and you had been treating. Yeah, it was better, no doubt about it. I understand it's your first week of speaking, so it's okay. Understanding the patient, okay. A female patient needs to be treated differently. A male patient needs to be treated differently. Once you said, "Can I check?" So I said, "Okay, where is she? So where will you check?" So that was supposed to be taken. I pointed you out that okay, you may better check it, and then in the end as well, you went the other way around, which was not supposed to be done. Rest went well. I was happy with the sympathy part you had. For example, sorry about your loss and such thing which I mentioned, so you were okay with that. The recap part was very good. You went that very well. And I was going by book this day. I was not giving you tough time myself. Oops. But, of course, if we don't know to whom do we treat, so how would we treat? We will mistreat. Okay. That's it. If you're preparing for OET, Gateway I8 Markaz is just available on a call. That is 0331873123. For my language is getting weak as well while talking to him. Thank you very much.
Thank you.
Thank you.
Bye-bye.